Today we will discuss about a common skin condition called urticaria. Otherwise it is called hives. For common men, it is known as allergy. This is due to the release of histamine and other vasoactive substances from mast cells. It can be due to ever so many causes. It may be a simple allergic, clinically it may be erythematous, edematous, evanescent, itchy lesions, which can be localized or it can be generalized. Usually it may be simple, but at times it may be life threatening. For example, if it is deep, called angioedema, edema occurring in the lips and periorbital region, that is a warning for the physician that you have to physician has to interfere immediately. That otherwise there will be laryngeal edema and suffocation and death. It has happened many times. So, this is a warning. If a patient with urticaria developing angioedema of the lips and periorbital region, such people are prone for laryngeal edema. So, immediate emergency measures to be taken in such situations. Urticaria can be classified as acute urticaria and chronic urticaria. Acute urticaria, when it lasts for 6 weeks, we call acute urticaria. When lasting for more than 6 weeks, it is called chronic urticaria. There can be ever so many causes for acute and chronic. Acute usually in most common cause in children is, earlier it was helminthiasis, worm infestation, which was very common when the standard of hygiene, example water purification, was not much there. Nowadays, rarely we come across urticarial reaction to helminthic infestations. And there are so many causes for urticaria. For example, food, bacterial infection, viral infection in the form of hepatitis B and C infections, thyroid abnormalities, collagen vascular disease, and H. pylori infection, and so many infections can cause. Drugs, another cause. Ever so many drugs, especially in atopic individuals, those who have a tendency for allergy, the asthma, sneezing and all, they may be prone for food, dust and drugs allergy. And collagen vascular disease, other SLE, systemic sclerosis, all this can have present with urticarial reactions. These are so many causes, and then there is autoimmune, as the body secretes some allergic enzymes that itself degrade the mast cells and produce the vasoactive substance. So that is another cause. And stress is one of the factors which provokes urticaria, at least in some way. So there are ever so many causes. To identify cause, the particular cause in a particular individual is very important to relieve the reactions. For example, if some patient is found to be allergic to food, we can have a test for that, or dust, we can again have blood test for that. From that we can identify the root cause. If you are pinpointing and treating the root cause, it can be completely curable. There are a set of autoimmune urticaria where there is body itself is producing autoantibodies. That also we can find with a blood test, a skin test. So that way you can identify the root cause. Very rarely we can, in some 25 to 30% of cases, we may not be able to identify the exact cause. We classify it as idiopathic. That is another thing. For a patient of urticaria, you have to take a proper history, detailed history. If there is any history of asthma, allergic tendency in the family, that should be brought out. And no, detailed history definitely reveals the focus. And some people definitely say that there is reaction when they take certain types of food. So such people, we are able to diagnose find out the cause doing a food test, food allergy test. So the usual investigations to follow is blood routine, absolute eosinophil count, serum IgE, thyroid function test, ANA, dsDNA, HbSAg, anti-HCV, then H. pylori, IgG, IgM. These are, and food test and dust test. These are the commonly done tests to find out the cause. If you identify the cause, there's a great relief for the patient. The relief, I have got patients suffering for the last 10 to 15 years. And when you find out the cause, we can give relief to the patients. So the take-home message is that, urticaria, you investigate and find out the cause, you treat the cause, and if and in some cases of urticaria that is life threatening, that is, as I said earlier, angioedema, that is when a patient get edema of the lips and periorbital, that is a warning for the physician and the patient that immediate steps to be taken for treatment in the form of IV injections. Even if it is suffocation is there, subcutaneous adrenaline and antihistamine, IV antihistamine, all these measures to be immediately taken.